Top 3 products outside of a good cleanser and a sunscreen would be number 1, a vitamin C serum. Number 2, you need a retinol solution at night. And number 3, you need a good moisturizer. Hey guys, Dr. Layke here. We are cross-pollinating our content. So we've got our Forever Young podcast that we're linking up to Instagram Live. And so for all of you out there, welcome back, beautiful people. I would love for everyone to start asking some questions. And I'm going to start off because we do have, as far as what we had started, the first question that came across. So we've got a 45-year-old male who has a thinning scalp and is asking, when is too early to start a hair transplant? All right, I'm just going to be quick, concise. Age is not the precluding factor here. So the determining factor is when you feel self-conscious. So some people just say, look, I noticed my hair starting to thin. That's the time to start doing something, whether it's PRP injections, exosome injections, microneedling to the scalp, whatever it is. And then if you see that those things aren't working, that's when we move into something like FUE, follicular unit extraction hair transplantation. And so the idea is start it early. That way it looks more natural. No one notices this, big change. All right, next question that we have. How do we determine sizing for breast augmentation? So in our practice, there are multiple different ways of doing it. We used to, put in sandbags and all these kinds of things. We used to put these sizer implants in. Now the easiest thing to do, we have what's called the Vectra 3D imaging system. It takes a 3D image. We place not only the size, but the particular brand and profile of an implant. And that way you can see what it looks like from every different angle. I know there's multiple different other machine and technologies out there, but I do think that a great one is going to be the any type of 3D imaging technology. All right. So next question, we were talking about post-operative rhinoplasty, and they were essentially asking what our regimen is. So traditionally for decades, we have taped the nose. So after the surgical splint comes off at a week, we've traditionally taped the nose, and that's always a great option. In our practice, again, using that 3D Vectra imaging technology, we create custom 3D splints. And imagine that tailored to the result that we promise. The idea is we create 3 custom splints that will fit the nose afterwards. And they're clear acrylic. They're almost like adjustable trays for the teeth. And you place those onto the nose. And really the most important part of wearing this is probably for the first 6 weeks, where we'll have you wear it for sure at night. And you'll wear it during the day when you can. Obviously, then you take it off. But really, we swell at night. And so that's really the time that we wear it. The follow-up question to that was, when should we start seeing the full expected results of the rhinoplasty? You have to imagine that it's 6 weeks to be event ready, even though it's going to look better at a week or two. And it's probably 12 to 18 months for the final result, depending on the thickness of the skin. What are the most popular procedures you do on younger people in their 20s? Listen, I think Botox and skincare. Botox is more for preventative purposes. And then skincare, microneedling, a good skincare regimen, facials. How would you fix a neck after being on prednisone? I'm very petite, but after taking prednisone, my necks look like tripe chin. Okay, so the idea is after prednisone tends to destroy the deep layers of the skin. So I think anything you can do to stimulate collagen. And I would probably add radiofrequency. So Morpheus is a great option. The idea is that Morpheus not only penetrates the skin, causing collagen stimulation, but also will force it with radiofrequency. What do you do for your skin? So I'm, to be honest with you, I'm biased. We have a medical grade skincare line called Beverly Hills MD. And I think 3 things that I always do outside of a cleanser and sunscreen is, although it doesn't look like it right now after the weekend, but you need a vitamin C type of serum. You need a good moisturizer and a retinol at night. You do those 3 things and honestly, skin can glow. Talk about lipo on the neck. Lipo on the neck, I think, is a great option for a heavier neck. It's not the only option. Sometimes people have a very, what we call obtuse angle. And so if that's the case, sometimes even when you're in your 20s, you have to do what's called a limited neck lift, where we remove fat from the underside of those muscles, because you can do all the lipo in the world, it's not going to give you a better contour. So I would see a board certified plastic surgeon or a facial plastic surgeon, and they will be the ones to help you determine what's best for you. But lipo of the neck, if you're a candidate, can be phenomenal. Best ongoing treatments for preventative aging and stimulating collagen. For me, obviously, look, a good skincare regimen needs to start in your teens and 20s. But ongoing skin treatments, I feel like if you do regular facials that clean the pores, I love the HydraFacial because it infuses hyaluronic acid after it cleans the pores. It even shows you all the dirt that came out of the skin. And then secondarily, you have to do something that's going to create some potential trauma. So that means microneedling by itself, microneedling with exosomes, or microneedling with radiofrequency, depending on the age group. I think definitely something that's going to cause a little bit of trauma to stimulate collagen. What is a deep plane facelift? Deep plane is a newer trend. We've been performing it for, probably a decade and a half, maybe even a little longer, or some element of that for a few decades. It's essentially where we are removing specific ligaments that attach to the skin and then resuspending the entire face. It tends to have a very natural result, less downtime, and a lower what we call a retuck rate, because sometimes, depending on the quality of the skin, you will get a little bit of sagging with any treatment really. But a deep plane is something that's performed now even for younger patients too, because it does look so natural. All right, what technology or biohacking hack are you most excited about for slowing aging? Look, I think that right now with the technology we have, it's really radiofrequency, whether it's topical or through percutaneous damage, like the Morpheus. I think that it can be amazing, but one of the companies that I find truly amazing is BTL and their M-Sculpt and M-Face technology, where you're doing 20,000 contractions in 30 minutes. The idea is with the facial one, I love it because it's causing not only muscular tone, but it also has a radiofrequency topical component. So it's really like, almost a mini facelift in 4 sessions. What products or techniques do you recommend for preventing acne? Look, the more we find out about gut, brain, skin, all of the contributions, or the connections, I should say, the first thing I would say is you have to look for an allergy. There's an increase in oil production when you're going through your teens. That's going to happen. You are going to have acne breakouts. What I would do is make sure that you cleanse your skin. You don't use as many astringents, because remember, drying the skin out only causes more oil production. So make sure that, if you do start developing acne, we try not to pop zits. We call them expressing that out, because sometimes you drive the bacteria down lower. If you do have, cystic acne, then you may need antibiotic therapy. Sometimes we even use spironolactone, which is, it will help reduce those breakouts. And then once you already have acne, now we have to start treating it. And so last ditch resort is Accutane. But as we approach that, I would say we have a resurface and restore system through Beverly Hills MD, which is like getting a chemical peel throughout the entire month. And that can help, really clean your skin. And the idea is you want to do regular exfoliation, not excessive exfoliation, because usually that mechanical or chemical trauma will hurt the skin. But the idea is you want to do regular exfoliation. So I would say if you have really oily skin, do it twice a week. If you have regular skin or dry skin, do it once a week, because we don't want to cause any trauma. All right. What do you think of Jennifer Aniston's recent look? Seemed like too much filler. How do we avoid that from happening? So 2 things. One, it's also known as pillow face. The second is filler migration. So it's adding too much filler to the midsection of the face. Even sometimes when it can look good in repose, when you're not making an expression, the idea is when you put too much mid-face volume, that when you smile or animate, it gives that pillow type of face or apple cheek, and that's not what you want. So my recommendation is, if you are going to get more than one syringe placed in a particular area, space it out. Come back and do a second treatment. So you undertreat, let it incorporate into the body. 3 weeks later, come back and do another treatment. Same thing for the lips. For those of you who are getting your lips injected and want to go from having no lip to a larger lip, do it in multiple stages. All right. Favorite supplements for beautiful skin. So look, one of my favorites, obviously, I'm biased. Through Beverly Hills MD, we have the Dermal Repair Complex. And really, it's a combination of things. There are several different active ingredients that not only promote healthy skin, but stimulate will provide the cofactors to creating healthy skin. And in addition, it has 2 ingredients that are DHT blockers. That's dihydrotestosterone, which is the aging hormone. And so I think it's an all-in-one supplement that will really help your skin. So Dermal Repair Complex, Beverly Hills MD, obviously it's our line, so I realize I'm biased, but we tend to put all of the best ingredients into one pill. Can you take them separately? Yes. So then take MSM, I would take hyaluronic acid, I would take a saw palmetto, and I would take vitamin C as far as a precursor to that. What else can we say? We also talked about fat transfer to the breast. We have been fat transferring to the areas of the body for a long time. I would say probably 2 decades. And the idea is we're refining our techniques. Now, fat, if you have it, is a definite option. If you don't have it, there's a new product that's coming out, should be here 4th quarter. It essentially is 10 cc's of cadaveric fat that's been stripped of all cellular elements, but contains the lattice work almost so that your body can grow into it. So that is an option. Be on the lookout. We're definitely going to see that soon. When is it too young to start Botox? I think, honestly, look, in your 20s, you can start it because it's really more preventative, but you're going to be doing micro Botox, right? So I would say that, in your 30s, it should be a must. I started, unfortunately, late. I started at 35, but now at 50, it just helps out with those deep furrows or wrinkles that can form. What are some techniques or products you recommend to prevent or eliminate stretch marks? You know what? Stretch marks are one of the most painful things for the person enduring them and for the treating physician. What it is there are 2 layers of skin: epidermis, which is the outer dead layers of cells, and the dermis, which is the healthy layer. Stretch marks or striae are tears in that dermis, but the top layer remains intact. And that's why you can see sometimes they're pink, sometimes they're purple, sometimes they're see-through, and they cause a lot of issues. What I would do is say, for rapid weight gain, especially in pregnancy and things like that, keep your skin as hydrated as it can. I mean, that's the only thing that we can say is keep your skin as hydrated as possible, because the drier it is, it's easier for those tears to occur. Sometimes the growth happens so quickly that it's just not possible. That's why you see guys who have taken steroids, and on the inner outer aspect of the arm, you see those stretch marks because it's just too rapid of weight gain for the body to settle into. And so it's one of those things that just, could wreak havoc. Now for treatment, listen, right now, there's no treatment for a stretch mark, no true treatment for a stretch mark unless you excise it, cut it out. And no one's gonna do that. So what we do is we try to stimulate collagen. And that's where, some of these technologies such as microneedling with radiofrequency can help reduce the appearance of those and stimulate normal collagen in the meantime. Excellent question. What would you say to your kids if they wanted to get face work in their teens? Is there anything you would say yes to? That's an excellent question. So as a plastic surgeon and a father of 3, the idea is I don't want them to think that they need to change anything. The way I look at it is this way. Obviously, there's a certain age at which that self-awareness can change the trajectory of your life forever, right? And so people who have certain things that would prevent them from doing normal teen things, right? So let's say there's a severe breast asymmetry and the person now becomes a recluse, doesn't want to go out, doesn't want to hang out with friends, doesn't want to do anything. That would be an indication. Usually, that would be, at 18. Someone who can't breathe, so a septoplasty, obviously, if there was, it'd have to be severe breathing. They've made it through skeletal maturity, and then we deem them a surgical candidate. Some of these things can change the trajectory of the rest of their lives. Usually, there has to be multiple factors that go into play. Once you're 18, start making decisions on your own and things like that, and you need to be guided by the physician. I want to better my skincare routine, but I have no idea where to start. I have dry skin and use a moisturizer. What other products do you recommend? I always say the same thing. Top 3 products outside of a good cleanser and a sunscreen would be number 1, a vitamin C serum. Number 2, you need a retinol solution at night. And number 3, you need a good moisturizer. Obviously, Beverly Hills MD is near and dear to my heart, but there are multiple other lines out there. Whatever works for your skin. And so just make sure every now and then with dry skin that once a week you throw in something that can help chemically exfoliate. I choose a chemical exfoliator, meaning it's enzymatic as opposed to ones with all the little granules, because sometimes those mechanical exfoliators can actually damage the skin. And so it either has to be very thin silt-like material, and you have to space out the frequency. One of the other questions that we did come across, eyelid surgery. So people always ask me, what's the biggest bang for your buck? What everyone sees first are your eyes. So for those individuals that are looking for anything done in the face, you want to take 5 years off just like that. That's upper blepharoplasty or lower blepharoplasty. How difficult is the process of dissolving fillers in the face and starting over? How long does the process take? Excellent question. So we dilute, so the product that eats up hyaluronic acid, let's say for sure it has to be hyaluronic acid, otherwise it becomes very difficult. There are other things such as polylactic acid and calcium hydroxyapatite. Those are not going to be covered here because those are very difficult to get rid of. But hyaluronic acids can be chewed up with hyaluronidase. It's an enzyme, and we dilute it, inject it into the particular area. Now, let's say we want to take an entire cheek and start over. Well, we obviously have to give enough of the hyaluronidase, and we dilute it because straight hyaluronidase will chew up some of your normal tissue too. So sometimes the process itself can be several weeks to a few months. And so you have to be patient with this depending on how much product needs to be dissolved. There are certain areas of the face that we keep injecting and injecting with hyaluronidase, but it's just not reducing. That's when you move over into some of the radiofrequency, microneedling with radiofrequency at a slightly deeper depth. I know that chews up some of the fat in the face, but if there are isolated areas where it's just residual product, sometimes that's the best way to break it up. It helps liquefy it and can resolve the issue while you get some skin tightening at the same time. These are all great questions, people. All right, what can I do? I burned and very wrinkled. So I'm imagining that you mean by skin damage. And so Wendy, you let me know if I'm on the right track. But as far as skin damage, the idea for me is we would love to resurface first. And so depending on where we're talking about, so let's say it's face, neck, décolleté, and hands, I would go with a fractionated CO2 laser because honestly, not only does it poke microscopic holes into the skin, but also it will ablate or remove some of that outer dry, dead skin. And so it will help you refresh. Depending how wrinkled you are and how much sun damage there is, you may have to do it more than once. Just one of those things. Afterwards, you definitely need to be on an adequate skincare regimen. And again, it goes back to those 3 things I say all the time. Outside of a good cleanser and sunscreen, you need a vitamin C serum, a retinol solution at night to help with cellular turnover, and then you need a good moisturizer. I always say that a good moisturizer is you put on your skin, you can still have a glow look, but it feels dry. Once you put a moisturizer on and 10 minutes later you still feel it, it likely means it's heavy silicone based and it's going to end up plugging pores, and it's not something that you want to put it 3 or 4 times a day. Whereas a good moisturizer you can put on as many times a day as you want. It'll give you that glow, that refreshed look, and it also has some good actives in it. When we do talk about full liposuction procedures, so let's say mommy makeover, remember when you're coming for a mommy makeover, it's more than just abdomen, breast. Sometimes what we do is we'll lipo thighs, arms, and we'll also do facial fat grafting. There are things that can be done at the same time because, listen, pregnancy changes your body. With all of the stress that your face endures as well, I think it's a great chance to help rejuvenate the face at the same time. So when we do perform liposuction, the idea is let's not waste that liquid gold. Let's process it and put it back into areas that are necessary. And Wendy, you go ahead, reach out to our Instagram, which is Plastics Docs with an X, PLASTIXDOCS, and I'll have my staff reach out to you. Andrea, love you too. All right, how do you get rid of white spots on my face? Lost pigmentation in a few spots on my cheek after I had a baby. It's so interesting because the melanocytes and areas of our skin can be hormonally mediated. And once the pregnancy is complete, some of those hormones are stripped from different areas. I would almost say that hypopigmentation is more difficult to treat than hyperpigmentation, right? Because we can't replace melanocytes. But what you can do is, again, I always go back to microneedling with or without radiofrequency. The more normal collagen I can put into an area, the higher the likelihood that it will create new melanocytes. And so what I would do is I would start with microneedling. See if that minimal micro trauma can cause even a % increase in collagen production to see if we can get some. If you get normal cells, normal collagen, you're gonna get normal pigmentation. So I would start there. I'm interested in a lip filler, but I'm worried it'll migrate or look strange on my face. How do you decide how much filler you inject? First of all, we have to look at the original anatomy. Sometimes it's virtually impossible in certain lips to give a very full lip to someone who's got nothing, depending how the lip is everted or rotated. There are some techniques that can help. I would say as a rule of thumb, I would never add more than one syringe at a time, okay? So for me, half a syringe on top, half on the bottom, or something like that. You always want the ratio to be 40%, 60%. The lower lip, believe it or not, people, should be slightly larger than the upper lip. When you start going Lisa Rinna, it's a different ballgame. So you want to tone it down a little bit and make it a more natural ratio. And so I would never go more than one syringe in the lips. The reason for that is not only can you run into vascular compromise, so it's so much pressure, it squeezes off the blood supply, and then you got a whole different ballgame. But the other thing is because, it's easier to build and let your body incorporate into that filler so it doesn't migrate. Last thing you want is to dump in a full syringe on the upper lip. Where is it going to go if you're trying to put it in a small space? It's going to go where you don't want it. And that's where people develop that big duck shelf. And so that's my recommendation. Which are best fillers, hyaluronic or Juvederm or some others? Look, a hyaluronic acid, a lot of them are all essentially the same. There are two differences. One is how much water they pull in, so how hydrophilic they are. The other is called the G prime. G prime just means how stiff they are. So if I'm going into an area that's going to move a lot, I want something with a slightly lower G prime that may pull in a little bit of water, right? So it just plumps it up a little, makes it look more youthful. But every physician finds one that works for them. So I do like the Juvederm products. I tend to like a product called Versa, Reviness, and it's called Reviness Lips. For the lips, and otherwise it's a great volumizer. It's less hydrophilic, so it doesn't swell so much afterwards and can really give you a volumizing result. What do you recommend for pregnant ladies who can't keep up with Botox laser treatments? Look, you're going to have a natural glow to begin with, and so that's why Botox sometimes isn't as necessary. I would say the one thing that you can do is you can do hydrofacials. So again, keep your skin clean. The body takes a beating no matter what. And so it doesn't matter, there aren't a lot of procedures that we will do ethically while you're pregnant. But one thing you can do is a hydrofacial, and there's nothing like cleaning your pores, because remember, sometimes you break out because you have increase in oil production. And we're gonna keep all the rest of the chemicals and peptides and things like that away from you while you're in pregnancy. Will it do anything? We don't know, but we're not willing to test it out. Sun Goddess, Wrinkles. I mean, look, many of us, when we were younger, we didn't use sunscreen. And even older than me, as sunscreen wasn't an issue. People would put iodine on their skin, and they would sit out using aluminum foil behind them. And so now the idea is we know to protect our skin. The problem is damage was done when in our teens and 20s. So what I would say is at this point, now we have to treat. And so that's resurfacing of the skin to start over and then put you on a good regimen of both a skincare routine as well as putting you on sort of a skin regimen. So should I wait until I regain my weight back about 40 pounds light? Listen, 40 pounds light, your face takes a hit. I always say the same thing. We draw a line right through here, and as we age, one of these is going to suffer. In pregnancy, obviously, we gain weight, but then you lose weight. Sometimes it drains and makes the face appear gaunt. So I would listen, if you think of any surgical procedure, we always want you to be in your optimal weight. That means if you need to lose a few pounds or gain a few pounds, that would be ideal for you because you'll have the most natural result. Nose liquid filler, is it safe or rhinoplasty is a better idea? It totally depends. Are there complications with both? Yeah, of course. Here's the thing with filler. You have to be a specific candidate. There are really 4 indications. One is to fill in a deep area here called the radix. And that is when you've got a hump and a deep radix, we can fill this part in and from the side it appears straight. 2 is to raise a drooping tip. 3 is to fill in little contour irregularities. Let's say you've already had a rhinoplasty or something like that. 4 is to try to straighten out or symmetrize a slightly crooked nose, with the caveat knowing that you're adding volume so it becomes a hint wider, but we can make it look straighter. And so the downside of nasal filler is that sometimes you can have vascular compromise. And so you get tiny little black areas with wounds and stuff like that. It's no fun. And it does happen. So if you are a candidate, what I would do is I'd go to a surgeon that does both. So I do both non-surgical and surgical rhinoplasty. Go to one that does both and they will guide you down a path. If they say, look, you're a candidate for filler, let's try it out, see how you like it. If you like it, let's do something more permanent in the future. Great question. What about facial exercises? Look, the face is very different from the rest of the body. Although toning the muscles is always a great idea, totally get it. Some of them, the mouth exerciser and things like that, I just don't know if that's going to do it. We really need to somehow exercise the zygomaticus major and minor. It can be difficult to do with just facial exercises. And again, if you look, here's a prime example. Look at a bodybuilder. And you're going to see they have this ring that goes around here. That is their muscle. That is hypertrophied. Because what are they doing? As they're lifting heavy weights, they're squinting as hard as they can. And so ultimately it builds that muscle. So it's not necessarily just facial exercises building muscle. They have to be sub-select ones. Palmetto BHMD stuff help if this bad. Always. So anytime you can reduce DHT, which is dihydrotestosterone, it's essentially the aging hormone blocker. Anytime you can reduce that, it will help the skin. Even if you don't see this, full transformation, your skin suddenly turns different. What it's avoiding is for your skin getting worse. That's why we use the dermal repair complex or any saw palmetto substitute, because that ultimately is going to block that DHT. Of course. Skin whitening, is it safe or not? So it depends what we're talking about here. I mean, usually we use things that strip pigment. We use it because we need to get rid of the pigment, right? And so we have a Pico 4 laser. It's really a tattoo-based laser, but it also reduces the hyperpigmentation of a scar or dark spots or things like that. So skin whitening, I think if you're talking about a topical, kind of like a hydroquinone, we use something called Triluma. It's a combination of hydroquinone, a retinol, and a tiny steroid to reduce some of the redness. And so I think that's a great option for turning. It's for cellular turnover, so we reduce fine lines and wrinkles, and it just happens to lighten the skin at the same time. So it gets rid of some of what we call dyschromia or pigmentation throughout the skin. Does C get rid of age spots? So I'm imagining you're referring to vitamin C. And yes, I think that vitamin C is a great quote unquote bleaching agent. The idea is it definitely works out well. So that's why I always recommend having that in your skincare regimen along with a retinol that's at night. All right. Are at-home laser treatments safe? Look, I don't know what at-home laser that I would consider that you could do at home that would be safe, other than, if you can afford it, you get one of the red light therapies. It's not true laser treatment, but I think it's, one of those things that can help, but it has to be the right wattage. All right, I think I got hyaluronic acid too much. Feels like the syringes she used, tons. there are needle lines under the skin. Is that possible? It's not that it's needle lines, but you have to imagine when we inject and as you remove the needle, you're probably applying product. So you may feel tiny little nodules under the skin. And so gently try to massage those out. So 30 seconds twice a day, do that for 2 weeks. If it doesn't help, then see your physician. Do you prefer Juvederm or Restylane for lip filler? You know what? Again, I mentioned it earlier. I think a lot of the hyaluronic acids are the same. In my hands, I feel like Restylane lasts a shorter amount of time, but in other people's, they may feel differently. I tend to like Rev&S Lips. I think it's a great volumizer. It has the least amount of hydrophilicity, so it doesn't draw on a ton of water. And I think it's really a great filler. At least in my hands. I read that Paul Newman used to dunk and soak his face in ice water every day to stop himself looking puffy on camera. Does this hack work? Any other good ones? Yes, it does. Obviously, ice reduces inflammation short term. And so anytime you want to get on camera, you put your face in there, obviously with breaths, but you do it on and off for 10 minutes, up to 20, and it can be a real revitalizing method for the skin. Other things, so a lot of actors and actresses, before they would go on screen, again, this is short term, they would actually use Preparation H, hemorrhoid cream, because it reduced swelling. Now, the caveat to that is you can't use that chronically. It has to be on an emergency basis. Which laser is best, soprano, ice, or diode for Asian skin color? I think one of the best lasers, you got to stick to a picosecond laser. We have the Pico 4, PIQ04. You can use that on any skin type, even African American. The idea is there's a setting on there that can reduce harmful or post-inflammatory pigmentation. And so we'll say, quote unquote, the bad pigment. So I would say a Pico laser is good. The other one you can use for everyone is the Clear and Brilliant. That's really for any skin type, and it will help retexturize the skin and reduce pigmentation. And last one here, do you give good discount for procedures for other specialty doctors as well? I'm not sure I understand that one, but I think that all docs are willing to treat patients respectfully, and we always make concessions some of the times because I'd rather help someone than not. Listen, last one here. Any supplements you recommend for anti-aging? Honestly, I would use the Beverly Hills MD Dermal Repair Complex. Obviously, it's our line. I'm biased, but I do think that it carries all of the actives that you need in one single pill. If you didn't want to use it, then go ahead and take hyaluronic acid, MSM, saw palmetto, horsetail powder. There's all different kinds of things. We just contain a proprietary blend as well that will provide all of the nutrients that you need. If you like this video, you're gonna love this one.
This is what we learned in the modeling business is if you don't like it, that's your problem. That's not mine. So I'm not here to please other people. I'm here to encourage. I'm here to teach. I'm here to inspire. And if I don't do that, I'll move on to someone else.